All right, so now we're going to get started on today's training, which is on finding, selecting, and adapting evidence-based interventions. So the objectives for today, by the end of today's training, hopefully you will be able to define an evidence-based intervention, find evidence-based interventions to address your problem and goals, apply criteria to assess evidence-based interventions, or EBIs, based on their effectiveness, potential for implementation in real-world practice, and fit with your objectives, setting, and population. We're going to just have time to touch on adapting an EBI to improve fit. So, Mary, do you have a poll? All right. If you can complete this poll and let us know where you currently go to find new ways to improve the health of your community. And you can pick more than one choice, but we just want to get an idea of where you all are currently going to look for new ideas, new interventions, new solutions. Okay, okay, keep going. Good. I'm seeing a lot of variation. That's good. All right, so a lot of you are going to your colleagues, others are going to their professional organization, a few of you are going to the community guide and to the evidence-based cancer control programs. All right. So what do we mean when we use the term intervention? And intervention is really just a solution, a strategy, something that you have chosen as a way to address your problem and improve health and health-related outcomes. This is a definition from Brown and colleagues where they refer to interventions as encompassing programs, practices, principles, procedures, policies, pills, and products. So it's very broadly defined when we use the term intervention. So examples of EBIs, or evidence-based interventions to increase colorectal cancer screening rates, include things like providing reminders to providers that a patient is due, or the Flu Fit and FOBT program, which is a specific intervention program that you can use, distribution of FIT or home fecal screening tests by mail, and well-designed educational materials that raise awareness and provide guidance on how to screen. So that's, we've been talking about interventions. The other part of this definition is evidence-based. And this is an evidence pyramid that you may be familiar with. At the very top, the strongest evidence comes from systematic reviews of the literature. The next strongest comes from interventions that have been tested in research, so single interventions that have been tested in research studies. And below that are practitioner reports and expert opinion or personal experience. I noticed a lot of you go to your colleagues, and that is a great place to go to find new interventions. But because then you're finding about what's worked for other people who work in settings similar to you, and that's really valuable. To be evidence-based, you would need to link the intervention they tell you about to either a systematic review or a research-tested intervention. In order to be evidence-based, there has to be evidence from research that it improved the intended outcomes. Next. So we're going to go through these two types of evidence-based interventions, and the first of them is systematic review findings. And these are broad recommendations for intervention approaches that are effective. It's the strongest type of evidence because it's based on a particular type of intervention and findings across multiple studies that use that type of intervention. And so some examples of systematic review recommendations for colorectal cancer screening include provider reminder and recall systems, client reminders, reducing structural barriers for clients. You can see that they're broad recommendations, not specific interventions. Places to find systematic review findings include PubMed, so you can go to the peer-reviewed literature and search for systematic reviews. The community guide, and several of you noted that you already go to the community guide to look for evidence-based interventions. And what the community guide posts are findings from systematic reviews of the literature. Another option, which is one of my favorite sites, is the What Works for Health site. And I will note that Mary sent you a document that provides links to the websites for all of these, so that you can go and look at them yourselves. I would say one of the biggest values to me of the What Works for Health website is you may have noticed that some of the systematic review findings on the community guide are a little bit old. And sometimes you can find it on the community guide and then go to What Works for Health and find a more current systematic review that you can use to supplement your community guide finding. And then the Cochrane collaboration is yet another site. Both PubMed and the Cochrane collaboration, you may want to partner with a librarian. And we'll talk a little bit more later about where to find librarians to partner with to search for interventions. All right. So we're going to look at the community guide website. For just a minute. This is one of the best sources of systematic review findings related to cancer prevention and control. It's a website that's created by the Center for Disease Control and Prevention. So these are some of the topics that the community guide generates systematic reviews for. And you can see it's a broad range of topics. It includes cancer and includes other things that are related to cancer, such as tobacco and vaccination and physical activity and nutrition and obesity. This is the site that I like so much, in addition to the community guide website, which is What Works for Health. And here you can see they have different kinds of topics that they're covering on this website. They have health behaviors, and you can see the list there: alcohol and drug use, diet and exercise, sexual activity, tobacco use. They have recommendations related to clinical care, to social and economic factors, and to the physical environment, for example, housing and transit. Okay, so with systematic recommendations, as I mentioned before, they're the strongest source of evidence for an EBI's effectiveness because they synthesize findings from multiple research studies. However, they often provide only limited guidance on how to do the systematic review recommendation in practice. And so this is where you might take a systematic review recommendation and combine it with something you've learned from your colleagues that they've done that works well, that where the colleagues' report provides you more practical guidance on how to do the systematic review recommendation in practice. The other type of evidence-based intervention is the research-tested intervention, which often will which are specific interventions with materials, protocols, and other resources to support implementation and delivery. EBIs to increase cancer control, to increase colorectal cancer screening rates include the SMART options for screening and the FluFit and FluFOBT program. These are just two examples. And you can see that they're named interventions. They're specific intervention programs that you can use in practice. The resource that Mary provided to you lists other sources of research-tested interventions, but for today, I'm just going to focus on the evidence-based cancer control programs. For some of you that have been in the field for a while, you may have called this the Research-Tested Intervention Programs website, or RTIPS. They recently changed their name from RTIPS to the EBCCP program. This is the homepage for the EBCCP. And if you go to search for programs on this website, you'll see on the left that they have a menu, and you can search for programs by program area, population focus, delivery location, community type, etc. Any combination of those, which is a great search engine. And you'll see they have 202 research tested interventions posted on their website. And those interventions cover all these areas that are directly related to cancer prevention and control. So the strengths of research tested interventions are they may provide detailed guidance and materials to support the implementation and delivery of a specific EBI. So that sounds really great. In practice, they're sometimes hard to find one that you can actually use in your setting. But if you can, it's a great option. But just recognize that it's sometimes hard to find one that's a good fit. Limitations are only a subset of interventions have been packaged, and guidance and materials may be designed for a specific setting or population that's different from your own, or they might be so resource intensive that they're not feasible for your location. So I'm going to give you 5 minutes to just go to either the community guide or the EBCCP website, and Mary's going to put those 2 URLs in the chat so you can go and search for an EBI and just look around for information and resources related to that EBI on the website. And if you find one that looks good to you, put the name of it in the chat. So I'm going to give you until 25 past. All right, I'm going to stop you there. Thanks to those who posted in the chat. Oh, here's some more coming in. Folks, I want to just take a minute and see if anybody has a question up to this point. All questions welcome. All right. All right, and thank you for posting. Oh, great, oral cancers and potentially malignant disorders. Great, great. All right, so we have provided, when we do this training in a longer format, we have people do a scavenger hunt where we walk them through searching for information on both the community guide and the EBCCP website. And so we've provided that scavenger hunt for you together with the answers to it if anybody would like to do that on their own time. All right, so there are actually a lot of evidence-based interventions out there, and it may seem overwhelming. And this is a quotation from a practitioner we talked to a number of years ago who said, honestly, the frustration right now for me is you've got Robert Wood Johnson, PolicyLink, CDC, Convergent Partnership, you name it, and every day somebody is coming out with something. And so, we can go to the next one. So one of our goals today is to give you as straightforward and streamlined as process as we could come up with for searching and selecting evidence-based interventions to meet your needs. And so we suggest that you start with the systematic review recommendations because they will provide you information broadly on the types of interventions that have evidence in support of them. Then search for and see if there is a research tested intervention that fits your need. And then finally go to the peer-reviewed literature if you need to find an intervention or to update your search and fill the gaps. So in searching for evidence-based interventions, you're going to want to start with your SMART goal. And we talked about this in the last session, and I'm sure you're all very familiar with SMART goals. So in this case, it's a little outdated since 2021 has passed, but your goal here is to increase colorectal cancer screening in the population between 45 and 75, and to particularly make sure that there are no disparities in screening rates for people of color. In addition to your SMART goal, as we reviewed in the first session, By the time you are selecting an evidence-based intervention, you've got your needs assessment, your community needs assessment, and you've talked to your stakeholders. You've learned a lot about what factors may be contributing to this problem in your population, what resources are available to address this problem, and what populations are at greatest risk. So you have a lot of information that you're starting with as you begin your search. So as you identify EBIs, following the order that we described before, you're going to want to be considering the best balance between the intervention's effectiveness, its potential to be implemented in your practice setting, and its fit with your population and setting your goals. So we're going to start with effectiveness, and honestly, assessing the effectiveness of the interventions could be a semester-long course. Fortunately, the websites that disseminate evidence-based interventions provide you information. They do this work for you. And so we're going to just tell you how to use a critical eye when you look at the information that's provided on the website. And so the things you want to look at are the methods used to test the interventions or to review intervention studies, the degree to which the findings are current, the magnitude of the effects. So that's how much improvement did this intervention achieve? And then, if available, is there evidence that it's effective across subpopulations and particularly in the population you're interested in working with? So we're going to look at the Community Guide website to see how they address this. And if you look at About on the website, most websites have an About menu. And often if you go to that About menu, you'll see here, you see methodology. And so here you can see the methodology that the Community Guide used to generate its systematic reviews. And you'll find out that they used a systematic process, not surprisingly. It's kind of a red flag if you can't find this on a website. You really want to be able to find that they are reporting and being transparent about the methods that they used. So then you can go to a specific intervention. In this, it's systematic review recommendation and supportive interventions that engage community health workers to increase colorectal cancer screening. And one thing you can find is the date that the systematic review was completed. And in this case, it's April 2019, which is pretty recent for the Community Guide. Some of their recommendations are pretty old, in which case it's still a strong source of evidence, but you may want to supplement it with more recent systematic reviews. Then you're going to want to look at what exactly did the Community Guide find. And here's the results and so the first thing you see is the number of studies that were reviewed, 66 in total, of which 17 were studies of colorectal cancer screening. And then you will also see that they tell you the magnitude of the effects. So you will see that for 9 studies that looked at whether or not it increased the number of percentage of patients that were up to test with any colorectal cancer screening test, they saw a 12.5 percentage point increase across those studies, which is a pretty substantial increase in screening rates. So that's great. All right, so that's effectiveness. So you want to be looking at the evidence in support of effectiveness. You also want to be looking at the evidence in support of whether or not this can actually be implemented in your practice setting. So interventions not only need to be effective, they also need to reach the intended patients and populations, be adopted by providers in practice settings, be implemented as intended or with fidelity, and maintained over time. Those are four of the 5 criteria in the RE-AIM framework, which is an evaluation framework that we're going to be talking about more next time. And the point of this is really a way of thinking that effectiveness is only a piece of the story. The intervention won't help your population if it doesn't reach them. And if providers, the partners you're working with, don't want to adopt it, and if it's so complicated or difficult that you can't actually do it the way it was intended to be done. So these are all considerations as you select evidence-based interventions. So these are some of the questions you can ask yourself if you, as you consider the potential for an EBI to be implemented into practice. Do prior studies of the EBI provide evidence that it can be implemented as intended? And I'll show you in a minute how the EBCCP website provides you data on that to answer that question. Are intervention materials and implementation protocols available in ready-to-use formats? That's a great thing if they are, and is very helpful. It doesn't necessarily mean you don't do the intervention if they're not available, but it's one consideration. Do stakeholders, so bring together the people you're working with and review the intervention with them and ask, does this sound like something that would be feasible for us to do? And then the last question is, do your stakeholders believe the intervention will reach the intended population? Will the people you want to reach participate in the intervention and be reached by it? Okay. So we're going to apply these criteria, and this time we are on the EBCCP website. So we're going to look specifically at the Flu-FIT and Flu-FOBT program, which I'll just say briefly is a program that combines distributing fecal test kits with getting your flu shot. So you have a captive audience that's come in for the flu shot. If they're eligible, you give them a cancer screening test kit to take home. And on the EBCCP website, they give you scores. They give you scores. To the left, you see research integrity, which is a score for the methods used to test the intervention. And unfortunately, each of the websites uses different terminologies for these things. But research integrity refers to the methods. Intervention impact is the magnitude. And then dissemination capability, which is cut off there, is the extent to which the materials are available that you need to implement it in practice. To the right, this website provides you, for many of the interventions, a re-aim score for the intervention. So this tells you in prior studies, was this intervention able to reach the intended population? Was it effective? Were settings and providers willing to adopt it? And were real-world settings and providers able to implement it as intended? So that's just another resource. This on the evidence, this is again continuing Flu-FIT, Flu-FOBT on the EBCCP website. They also provide a link where you can see the actual program materials that they have available for you to use to implement this intervention. So I'm going to give you 5 more minutes to actually go on a website. And you can either go on one of the 2 websites Mary shared before, or go on a different website from the resource list that Mary provided, and to see if you can go on the website and answer these 4 questions. What types of EBI does the website disseminate? And by that, I mean, is it systematic review findings or research tested interventions? How current is the information about a particular EBI? What methods were used for selecting and rating the EBIs on that website? And what implementation materials and guidance are provided? You may not, probably won't be able to get through this in 5 minutes, but I just want to give you a chance to play around on the websites a little bit, and we'll stop at 12:42. All right, anybody have any questions? Anybody find anything they think they might use? Are you believing in the value of finding an evidence-based intervention to use in your project, or any concerns about that? All right, I'll keep going. So the final criteria is fit. So in addition to effectiveness and implementation, you want to find an EBI that fits your population and setting, and I would extend beyond that, fits particularly your goals and objectives and the specific factors that are contributing to the problem in your population. So there are a number of things to consider when considering fit across different evidence-based interventions. Does it fit your health problem, your goal, your population, your setting, those contributing factors that you identified during your needs assessment at the level of the patient, provider, or community, and what kind of resources do you and your partners have available to you to implement an intervention? So this is just an example of some of the factors that you might have identified during your assessment. The kind of data collection we discussed in the first part of this training that Mary led. So you might, in your both search of the literature and existing local data and talking to your stakeholders, have identified that screening rates are lower among populations that are uninsured, male, African American, and Latino. And your stakeholders might have told you they had particular difficulty tracking fit screening test kits, and that their participants had problems getting transportation and insurance coverage to complete diagnostic screening. So you would be looking for evidence-based interventions that specifically addressed those factors if possible. And we provided, Mary sent to you a comparison tool that you can use as you're considering fit and comparing different possible evidence-based interventions. So in sum, in selecting an evidence-based intervention, you're really looking for the best balance between effectiveness, potential to be implemented, and fit. And across those, you're going to pick one or more evidence-based interventions to use in practice. So what if you don't find any evidence-based interventions that fit your population or goals? And this sometimes happens, that the websites don't have an intervention. At that point, you may need to go to the literature and do a search. And so, for example, you might search PubMed for what interventions are effective at increasing colorectal cancer screening rates among migrant farm workers, if that's the population you're working with. We strongly suggest that you find a librarian, and we're very fortunate in North Carolina that the AHECs often include a librarian, and those librarians both have the expertise to help you search. They also have access to journal articles for free, as opposed to having to pay for them. And so there's a link there where you can find the AHEC closest to you if you aren't already aware of that. In addition, you can also search the literature for more recent studies of an EBI and or studies in a population similar to your own. So even if you find an EBI, it can be helpful to look at the literature for additional information. And I just got a comment. I really like the feature on Google Scholar that lets you filter out articles older than a year, 2 years, 5 years, etc. So that feature is also available on PubMed. And so you can make sure you're searching only for the most recent articles, particularly if you're trying to update a slightly old systematic review. You really want to focus on the more recent studies. So that's a great tip. All right. All right. So we're going to end off with a very brief discussion of adaptation. Adaptation is most relevant if you're using a research-tested intervention. And that's because those are designed to be used as a package. A specific intervention was designed to be effective and was tested and found to be effective because it was delivered in a specific way. That doesn't mean you won't need to adapt it, but it does mean when you adapt it, you need to use care to make sure it retains the effectiveness it achieved in the research study. And so this is the 4-step process that we recommend. Is you use the FIT tool that we just showed you to look at where the intervention doesn't really fit. Then you can think about what you need to do, what parts of the intervention you may need to adapt to improve fit. Then in step 3, you can make those adaptations. And then in step 4, pilot test those adaptations to make sure that they work with your population and setting. Mary has provided a 1-page handout on guidance for adaptation, which tells you in 1 page what's a red light, which means you should not adapt it in an evidence-based research-tested intervention, yellow for adapt with caution, and green, it's safe to adapt. I would say that if any of you are at a place in your work where you want to adapt a research-tested intervention, first, we have, on the next slide, we have a webinar that provides more detailed guidance on adaptation. And so you can access that webinar and watch the more in-depth. However, we would also recommend that you contact us for consultation and support in thinking through how you're going to adapt an evidence-based intervention, and we are happy to provide that.
I'm going to put it in the chat quick and then I'll advance your slide.
Okay, great. Does anyone have any questions at this point? All right. Okay, so it will take a little hunting to find it at the website that Mary has posted, but you can find a lot of great things there, so it's worth the hunt. So we have completed today find and select EBIs and touched on adapting EBIs. Next time we get together on the 29th, we will talk about implementing EBIs and evaluating their impact.